World COVID deaths passed 3 million at the weekend, with a particularly disturbing 20-fold surge in new infections in India this month. Meanwhile, in Europe, new daily cases have stabilised after a third wave, but the sluggish vaccine campaign has been dealt a further setback. US pharmaceutical giant Pfizer has hiked prices on future orders of its jabs in Europe, potentially raising the cost more than 60%. And conveniently, it comes at a time as Brussels is seeking a brand new contract with Pfizer for next year's vaccines. You're going to want to hear this, the details now, with RT's Saskia Taylor.
You wouldn't think that big pharma and ethics go hand in hand, but you clearly haven't met Pfizer.
If we were to implement free, open market principles in pricing the product, we could go to huge prices and sell everything we can manufacture, but it would be unethical, I think. We will not do it because that's really taking advantage of a situation, and people will not forget if you do that.
It must have been hard then when the third wave started coursing through Europe. More curfews and lockdowns were announced, hospitals were overrun, and Pfizer couldn't take advantage, even though it's sitting on the thing they say is the only way out, a vaccine. But no, that would be unethical. The people will never forget. Turns out, though, Pfizer doesn't really care about people. It cares about fresh dollar bills. So it hiked its prices after all.
Vaccines are very expensive. They save human lives. They allow economies to reopen, but we sell them at the price of a meal.
A very nice meal in a very nice restaurant. After all, Pfizer's vaccine is the most expensive on the market, and it can't start handing out discounts just because it's a once-in-a-lifetime global pandemic. Some countries then who can't afford Pfizer's prices but still want their, citizens to live, thought, well, that's fine, we'll just produce it ourselves. Well, no, because Pfizer and co. are not only lobbying the Biden administration to stop low-cost vaccine production to help out low-income countries, they even want those countries to be sanctioned. Ethics. But even for those who do have the cash, purchasing Pfizer's beginning to break the bank.
Pfizer was 12 euros, then it became 15 euros. Contracts are now being signed at a price of 19.50 euros.
And with the EU signing off on a future order of 900 million doses, those extra euros really add up. But as Pfizer well knows, the bloc doesn't really have a choice, because Brussels' first pick, AstraZeneca, has become vaccine non grata after its link to rare blood clots. At this point, it would probably struggle to hand out its vaccine for free, let alone charge for it. Johnson & Johnson's hit the pause button over the same concern, and the European Medicine Agency's not keen on approving any other shots at the moment. So the Pfizer jab stands as the sole saviour. All 19 and a half euros of it. That's if you don't count dose 3. Surprise!
A likely scenario is that there will be likely a need for a third dose somewhere between 6 and 12 months, and then from there will be an annual revaccination. But all of that needs to be confirmed.
A vaccine with 3 doses in the first year and a booster annually after that. What a tidy little way to keep those billions coming in. To hell with cooperation, to hell with morality, to hell with humanity. You really have to hand it to Pfizer. Even in a pandemic, it's just another day, another dollar.
Well, we spoke with Mr. Bharat Pankania, a senior consultant at the Disease Control Centre of Exeter Medical School. He said keeping vaccines affordable is going to be a vital part of ending the pandemic.
It's a tragedy. It is a tragedy, and nations are beholden to the supplies of vaccines and the price of the vaccines. We have a global pandemic, a very serious global pandemic, and it is incumbent upon pharmaceutical companies, the World Trade Organization, and the richer nations to keep the vaccines at a low price as possible, and to promote the giving of the vaccines cheap and at a cheaper rate to all the other nations. Because if you have runaway, uncontrolled infections in the poorer nations, what will happen is that is the right recipe for variants of concern to emerge. So it is in our own self-interest to immunize the world at pace as fast as possible. That's what's called living in a global village. It is our duty to do this.